Hey guys, it's Dr. Eric. I want to tell you about vitamin D and some other important supplements today and answer some questions that I get from a lot of people. I do a lot of supplement consultations where people will bring in a bag of supplements and I'll ask them like, why do you take this? Why do you take this? And they'll say, well, my aunt told me about this one. Somebody in Vitamin Cottage told me about this, and I saw an infomercial at 2 a.m. on this one. And that's not the best way to make decisions. So what I want to tell you about are the things that I do recommend so that you can be healthy and give your body everything that it needs. So the first one I want to discuss is vitamin D. If you've ever heard me do a workshop or been to a workshop, you've heard me talk about vitamin D. There's over 200 processes in your body that are controlled by vitamin D. It's the biggest vitamin deficiency in the United States by far. Almost everybody that I test is vitamin D deficient or less than optimal. So what vitamin D does for you primarily is it boosts your immune system. All right, immune system function is driven by vitamin D. It's also very good for bone health, things like osteoporosis. But when it comes to the immune system, like if you look at people with COVID that were hospitalized, 88% of people that were hospitalized with COVID were vitamin D deficient. That was really your first line of defense against COVID and against any cold, flu, illness, anything like that. It's also, there's an article in the Archives of Internal Medicine that shows that if people had between 60 and 80 nanograms per mole of blood vitamin D, which means when you go get tested, it will say between 30 and 100 is normal, which is insane. That's far too big of a range. The actual number you want is between 60 and 80. Because between 60 and 80, that's where all the research has been shown on what it does for your immune system. So specifically, they say if everybody had between 60 and 80 nanograms per mole of vitamin D in their blood, if that was their number, we would prevent 58,000 cases of breast cancer every year, 49,000 cases of colon cancer every year, and 75% of the deaths from those two diseases, which is far more than we're ever going to prevent with the Think Pink and the ribbons and all of those things. And a lot of people ask me like, why are you like bashing on the pink things? I don't have a problem with supporting people with breast cancer. I think that's great. Unfortunately, we've turned this into pink M&Ms and pink buckets of fried chicken. We're not going to cure cancer, breast cancer, by eating pink M&Ms. That's what causes cancer in the first place. The way we're going to reverse breast cancer is making sure people have vitamin D in their blood. So you want to be between 60 and 80. Now, how much should you take on a regular basis? Everybody's different. The answer is depending on how much it takes you to get to 60 to 80. So I recommend 5,000 IUs. So the vitamin D here is 5,000 IUs. What's very important is this also has vitamin K too. Vitamin D and vitamin K need to be taken together. You don't take them separately. They have to go together. So this one's from Designs for Health. It's vitamin D Supreme. This is the biggest bang for your buck in any supplement that I've ever seen because it has vitamin D and vitamin K. Typically it's one a day for most people. So this lasts people like 2 months, which is a ridiculously good buy. All right, so this is what I recommend. It also gets absorbed in your bloodstream. So if you take cheap vitamin D, it's not going to get absorbed properly the way it should. So vitamin D Supreme is what I recommend. 5,000 IUs is a good baseline, but you may need more. So if you've been tested or if you get a blood test and you see where your number is, you could tell me where you're at and I can recommend what the actual dosage is. For instance, I take 10,000 IUs of vitamin D every day to get my blood level between 60 and 80. Now, if a doctor or anybody ever told me I'm taking too much, I would look at them and say, no, I'm taking a perfect amount because it's between 60 and 80. It doesn't matter how much you take. It matters how much your blood levels are reading and how much you're absorbing. So I need to take 10,000 IUs to get my blood level to that. So if anybody ever tells you, oh, 10,000 is too much, they haven't done any research because they don't know what your blood level is in the first place. You might only need 4,000 or 5,000 IUs, but that's why it's important to get that test. But a good baseline is 5,000 IUs, and that's what I recommend for the vitamin D Supreme. Okay. Next one is Immunoberry. Speaking of the immune system, so Immunoberry liquid, this is what I call the in case of emergency break glass. I have this in my house, and it has specifically two things. One of them is called beta-glucans. Beta-glucans supercharge your immune system in the short term. They increase your B cells and your T cells. They help your body fight viruses and bacteria very quickly in your body. So this is the best source of beta-glucans. Your body doesn't make beta-glucans. It usually comes from some type of medicinal mushrooms like the ones that are in here, like the reishi mushrooms that are in here. It also has elderberry, which you've seen is in like sambucol or a lot of the cough medicines that are not medicines, so like the alternative remedies for cough and cold. Elderberry is very good for your immune system. But the other one is called astragalus. And astragalus supercharges what's called the complement immune system system, so your body can recognize the invaders very quickly, kill those invaders very quickly, and get your body feeling better. So what happens with this, if you have an immune system, if you have like chronic sinus problems or your immune system's not great, you can do a dropper of this every day. I don't take it every day. I usually take it if I'm expressing symptoms. So a couple of weeks ago, I was expressing symptoms. I had a fever, I had a cough, I had the whole thing, right? And I don't call it being sick, because I wasn't sick during that time, because my body was doing exactly what it was supposed to do. That fever was killing the viruses and the bacteria exactly how it was supposed to. But what I was doing was taking Immunoberry, and that reduces the duration of the cold or flu or whatever you're dealing with. A lot of times it'll cut it in half. So as soon as you start feeling like scratchy throat, or you're coughing, or you feel like you're coming down with something, you'll do a couple of droppers of these in a day, and it decreases how long you're going to have that whatever illness that you're dealing with. So I recommend the Immunoberry liquid, like in case of emergency break glass. Almost everybody that I know has one of those in their house. And then the last one here from Designs for Health I want to talk about in this video is called Insomnitol. One of the biggest issues I see coming up now, especially after like post-COVID, is people can't sleep. Like I'll do a consultation with a patient and they'll say, I don't sleep. You should be sleeping between 7 and 8 hours a night uninterrupted. Right? It means you're not waking up, going to the bathroom, getting out of a REM cycle. 7 to 8 hours is what you should be sleeping. If you're not sleeping 7 to 8 hours, most people are only getting 5.5 hours of sleep. That dramatically increases your risk of dying prematurely, increases your risk of Alzheimer's and dementia, because that's when you're sleeping, you're actually draining waste products out of your brain called beta amyloid proteins. And if you're not getting those REM cycles, REM cycles, then you're not draining that stuff. You're also not making serotonin. And serotonin is what makes you happy, right? So insomnia and depression and anxiety go hand in hand a lot of times. So if you need help sleeping, what I recommend is not just taking a bunch of melatonin or something, is doing something that hits all of the bases, and that's what Insomnitol does. Now these are chewables you can keep right next to your bed. You take them about a half hour before you go to bed at night. And there's 3 things in here that are very important. The first one is called L-theanine, okay? L-theanine is an amino acid that your body uses to make GABA, which is your kind of nature's Valium. It helps your body go to sleep. Also helps your adrenals. If you're really stressed out, L-theanine is very good for you. So it has L-theanine. Second thing that it has is 5-HTP. 5-HTP is the precursor to serotonin. So you're giving your body what it needs to make serotonin, and serotonin is what helps you get to sleep and stay asleep. Third thing it has is inositol. Inositol has been shown to be more effective than sleeping pills. Again, helps your body regulate those normal sleep rhythms. And the last thing it has is melatonin. Right? So it has the proper dose of melatonin, which is much lower than most people take. Most people take way too much. And melatonin helps regulate your sleep cycles and helps you stay asleep. I had a patient who came in who was sleeping about 3 hours a night, started getting adjusted, started taking the Insomnitol. He's sleeping 7 hours a night and feels like just a completely different person. So if you're having problems sleeping, instead of doing sleeping pills or taking Benadryl or trying to have a couple extra drinks so you fall asleep, you want to give your body what it needs to be able to sleep. So those are the ones that I recommend for just about everybody. And if you're having problems, again, with immune system, you got the Immunoberry. If you have a pulse, that's vitamin D. And if you're having problems sleeping, that would be the Insomnitol.